But let's talk a little bit about the variations of a SMAS facelift. Again, a SMAS facelift is working on this yellow layer called the SMAS that's right under the skin. It's adherent to the skin. And when surgeons, any surgeons really doing a facelift, they're doing something to the SMAS. So the variations for SMAS facelift surgeons are something called a SMAS plication. When they see the SMAS, they don't even make any cuts on it, but they just put some stitches to try and tuck it out. But when you do that, it kind of accordions on it something. There's a lot of tension. It's a lot of pressure. It wants to spring back down, and that's generally what happens. It'll look good for a bit, and then it'll fall right back down. The second variation is a SMAS imbrication. That surgery, they'll cut out a little wedge here, football-shaped wedge of the SMAS to take away some of the accordion effect, but then put stitches in, but it's still under tension because it's not released. So it'll do a little bit better, but also eventually that'll stop and bounce right back down. Most surgeons do a sub-SMAS facelift, where they'll make the incision on the SMAS there, and then they'll lift it up there like a sheet. They're lifting up the sheet off a mattress from here to here, okay, before these Velcro-like attachments. So that way they're getting a little bit more lift and stretch, and it can glide over itself. And then they stitch it into place. And that does okay, but it's still not releasing the Velcro-like attachments here that are holding that whole SMAS down. So it's kind of like pulling it against a sheet of plastic that's nailed to the ground. It doesn't want to move. All it's going to do is cause some contour deformities and folds and funny pulls.